It's October. That means it's Breast Cancer Awareness Month. And with so much going on in the world now with the pandemic, it's still important that you take care of yourself, get your screenings, take action. We're partnering today with GBMC, and I have Dr. Priyanka Mittar in the studio with me right now. She's an oncologist at GBMC. Thank you so much for joining us.
Hi, Kelly. Thanks for having us.
Talk to us about the role that an oncologist plays. You're terrified. You go get your screening. You find out you have cancer. What role does the oncologist play?
Yeah, we actually play quite a large role depending on the type of cancer and the extent of cancer. At GBMC, we have a multidisciplinary approach incorporating oncology, surgery, and radiation. And medical oncology, we basically look at you as a whole and tailor an individualized plan that can include pills, it can include chemotherapy, it can include targeted therapy, and at GBMC also we have a very robust clinical trial program.
Let's talk about some of the treatment strategies for breast cancer, especially if it's caught early. How is it treated?
Yeah, it's a constantly evolving. It really depends on the type of cancer. About 2/3 of breast cancers are hormone positive and overall have excellent outcomes. And we have various genomic assays and treatment strategies that we can individualize care at GBMC.
And you're looking at our phone bank right now. We have experts standing by in the next studio taking your calls, all socially distant with their mask on. The number to call is 410-671-0702. Doctor, I'd imagine anybody who has cancer or compromised immune system, especially now during this pandemic situation, what do you say to them about how important it is that you continue your treatment? Because a lot of folks were afraid to go to the hospital for a while.
Yeah, no, that's a great question, and it's very understandable. At GBMC, we're taking a lot of extra precautions. I do think it's important that people resume screening mammographies, and really we wouldn't want to miss something that's early and could be potentially curative.
And you talk about the concerns about recurrence. Talk to us about that in terms of after you've made it through your 5 years at that point, and you're still worried about it coming back. What do you say to those folks?
So definitely at GBMC we have a survivorship program that's very active, and studies have shown really nutrition and diet plays a large role. We recommend at least 50% of your diet be plant-based if possible. We also know that exercise and limiting alcohol intake has also been shown to be the major lifestyle changes associated with a decreased risk of recurrence. And really trying to get your body mass index as close to 25 as you can. So really weight reduction and optimal weight is really, as hard as it is in these times, is really said than done. Yes.
All right, Dr. Mittar, thanks so much for joining us. The number again to call is 410-671-0702. Our experts are standing by live, just waiting to take your calls. Jamie, I'm going to send it back to you.
All right, thank you. Listen.